Oncology for me is more of a calling than a job. I think it's a sacred privilege to kind of walk these paths with the patients who we all are mortal, and we get I think a heightened sense of that when you're faced with a cancer diagnosis. But to be able to intervene and to change the outcome of what would have happened is extremely satisfying. We have lots of cures in my specialty. We do have patients who have advanced stage disease who ultimately succumb to their disease, but you have to look at what you're able to offer them as wins as well. Adding years onto their life that is not years of just being sick. They get to another anniversary, they get to another grandchild's birth, they get to a special family, tradition, trip. And so these are you have to count those as wins, even though at the end of it all, they still may die of their disease. My philosophy with the patients is, I always tell them, you're captain of your ship, right? I really want them to feel empowered that they're the ones that are making decisions for their care. Many times patients feel like that they lose control when cancer, and then all these imposing forces are upon them they didn't ask for. And I try to give them as much power back as I can in making decisions about their health care. So I tell them that they're the captain of their boat, and I hope to be a trusted navigator, telling them what's around the next bend, weighing in and giving them my advice, because I've gone that route with many patients, and this is the first time they've gone on this journey. We're in an exciting time of healthcare where we are embracing team-based care. As the physician, perhaps I see myself as the quarterback of the team, but I've got a lot of talented people that work with me, and it would be impossible to give the care that we do to our patients without every single member of our team. Every day before clinic, we call it a huddle. We get together for 30 minutes and we'll go over every patient that we're seeing that day. We'll kind of exchange information of what has happened with that patient since we saw them last, what their needs are, and kind of plan the day so that we can be prepared to take care of the needs of that patient when they present. As an oncologist, you are privileged to interact with a brother or sister on issues that are very personal, and you get that common denominator that we're all here just for a little while, and it gives perspective. I tell people when I go home, you hug your wife a little tighter, you tell your kids you love them a little more often. It gives you perspective, and that is I think a gift. Some people just kind of go through life never imagining that they're going to get thrown a curveball, and I see patients get thrown curveballs every day, and most of them can handle it quite well, and it's sobering, and it's very satisfying.